Hey guys, I'm a rheumatology specialist. You've probably heard someone say that the tongue is the strongest muscle in the body. That's actually not true, but it does hold many secrets about your health. So grab a mirror, take a look, and let's get into it. First, stick out your tongue and see what color it is. A normal, healthy tongue is pink with little bumps called papillae on the surface. But if your tongue looks red and smooth, that's called glossitis, and it can be from a nutritional deficiency. For example, the woman in this photo presented with 1 month of tongue pain and reduced taste. If you look closely, you can see that she no longer has the normal little bumps on her tongue. It turned out she had a severe vitamin B12 deficiency caused by an autoimmune disease called pernicious anemia. That's a condition where your body creates antibodies that prevent the absorption of vitamin B12. And this is her tongue just 1 month after taking B12 injections, pink and bumpy just the way we like it. A reminder to all vegetarians and vegans out there, you're at a higher risk of B12 deficiency, so make sure you're taking your supplements. Now try this. Can you touch your tongue to your nose? If you can, it's a rare talent. Less than 10% of the population can do it. In medicine, of course, someone put their name on it. It's called Gorlin sign and is more common in people with Ehlers-Danlos syndrome, a group of genetic conditions characterized by stretchy skin and hypermobile joints. But it could also be a sign of macroglossia, which means an unusually large tongue. So how do you know if your tongue is too big for your mouth? Check the sides. Do you see imprints of your teeth? That's one sign of macroglossia. If your tongue suddenly gets bigger, it might be due to an allergic reaction or infection, which can make it hard to breathe. That's a medical emergency. Go to the hospital. But if it's been growing slowly over time, consider conditions like hypothyroidism, low thyroid hormone, acromegaly, too much growth hormone, or amyloidosis, a condition where amyloid proteins deposit in organs including the tongue. If your tongue's always been big since birth, it's probably just congenital, just one of the things that makes you, you. Now, open your mouth wide and stick out your tongue. How much can you see in the back? Your soft palate, uvula, the pillars? This gives you a score called the Mallampati score. It's a tool to assess how difficult it might be to intubate a person and put a breathing tube down their throat. The higher the score, the harder the intubation. We try to assess this before intubation, but in emergencies, that's not always possible. In my experience, intubation happens in unexpected life or death situations. It's not always realistic to sit someone up and examine their throat, so I look at other factors: thick beards, wide necks, missing teeth, limited neck movement, or facial trauma. All of these contribute to a difficult airway, and sometimes even an easy one can surprise you. That's why I always have plan A, B, and C with all the equipment ready. I clearly get excited about intubation and code blues, but back to the Mallampati score. It can also predict your risk of sleep apnea, a condition where breathing stops and restarts many times while sleeping. If you have a high Mallampati score and know you snore or feel tired during the day, it's worth getting a sleep study. Sleep apnea is linked to car crashes, heart attacks, and strokes. But the good news is, it's treatable. Now, if you notice a thin white coating on your tongue, that's usually normal. It should go away when brushed. If it doesn't, there are 4 main causes I usually think about. The first is thrush, a yeast infection causing raised white patches that look like cottage cheese. These patches can be rubbed off, revealing a red, irritated tongue that may even bleed. It often follows antibiotic use, which changes the normal mouth bacteria, allowing yeast to grow. But it can also occur in people with weakened immune systems, like those with uncontrolled diabetes, HIV, or undergoing chemotherapy. If the white patches don't rub off and feel flat and hard, it could be leukoplakia, usually caused by tobacco or alcohol. It's important to monitor these, because they can become cancerous. Talk to your doctor or dentist if you notice this. If the white patches look lacy and come with a burning sensation, that sounds more like lichen planus. It's likely immune-related and often improves with steroids. If the patches are mainly on the sides and look like hair, it could be hairy leukoplakia caused by the Epstein-Barr virus, the same one that causes mono. But not everyone with mono gets this. It's a sign that something's off with the immune system. This photo is of a 29-year-old man who felt fine but had white patches on his tongue. Testing revealed he had HIV. Once he started treatment, the white patches disappeared. Next up, how agile is your tongue? There are 5 tongue movements: rolling, cloverleaf, folding, and twisting left and right. Most people can roll their tongue. Cloverleaf is the hardest. Only 5% of people can do all of them. This ability seems to be partly genetic, but you can probably practice to improve it. That said, if you can do the movements now but can't later, that might indicate a neurological problem or a lesion affecting tongue movement. As a rheumatologist, I see people with Raynaud's phenomenon all the time, an exaggerated cold response where blood vessels clamp down, reducing blood flow. It usually affects fingers and toes, but sometimes the tongue. Here's a 29-year-old woman whose tongue changed color and became numb in the cold. This was her first symptom of scleroderma, an autoimmune disease that can thicken skin and organs. There are other causes too, like a woman with tonsil cancer who developed Raynaud's in her tongue after radiation treatment. She's cancer-free now but avoids cold foods to prevent symptoms. Ever heard of strawberry tongue? That's when the tongue turns red with enlarged papillae, classic for scarlet fever or Kawasaki disease. The latter causes inflammation in kids under 5. Geographic tongue looks scary but is harmless. It's more common in people with psoriasis and asthma, probably immune-related. No treatment needed. It goes away on its own. When I check under a patient's tongue, I expect to see saliva pooling. If I don't, I consider Sjögren syndrome, an autoimmune condition causing very dry eyes and mouth. There's a simple test. Have the patient sit and spit into a container. Some barely produce saliva, which affects dental health and causes a cracked, painful tongue. Thankfully, Sjögren's is rare and dry mouth is more often a medication side effect. Now let's talk about hairy tongue. These photos are dramatic, fair warning. It's caused by keratin buildup on papillae. Keratin's what makes up hair, but don't worry, it's not actual hair. The hair can change color based on bacteria, diet, and hygiene. The most dramatic? Black hairy tongue. A 55-year-old man intubated in the ICU for 11 days developed it, likely due to smoking, antibiotics, and no food to help naturally clean his tongue. The good news? With brushing and scraping, it went back to normal. It's not just adults. Here's an 8-week-old baby with a black tongue. It looks serious, but was just bacteria and fungi. No treatment needed, it resolved on its own. Have you ever had a canker sore? The medical term is aphthous stomatitis. These painful, non-contagious ulcers go away in 1 to 2 weeks. 1 in 5 people in North America get them. The cause? Still unclear, but there's likely a genetic component. I get them, my mom gets them, my grandmother did too. If you suddenly start getting them after never having them before, talk to your doctor. It could point to an underlying condition. If a sore doesn't go away after a few weeks, or if you feel a lump on your tongue, think about cancer and get checked out immediately. This man had a small tongue mass for 6 months. It looked minor, but it turned out to be cancer. He got it removed and was cured. He smoked, which likely contributed. HPV, the human papillomavirus, is another risk factor. Luckily, we have a vaccine that protects against HPV and can prevent cancer. How amazing is that? Just remember, tongue cancers often don't hurt or cause issues early on. If you notice something strange, get it checked. If you liked this content, it's part of a series. You can keep learning about what your nails or hands say about your health. Let me know what you want to learn about next. Maybe your eyes or ears. Leave a comment, subscribe, and I'll see you in the next video. Bye for now.